Good evening, everyone. I'm here to talk to you tonight about a topic that's really deeply personal to me and I think very relevant to the times. And it is actually the topic of the opiate and heroin epidemic that's occurring here in America. And I want to discuss the nature of the epidemic, its history, and kind of how we got to where we are and the challenges it's posing, as well as the potential reasons why this should not exist, what we can do to treat it, and also what we can do individually or immediately to take action on. So I want to start out by asking a question, really very honest, hopefully. Who here has ever been prescribed Percocet or Vicodin? A majority of the classroom. And it's really a common prescription that's offered for minor surgeries. It could be your wisdom teeth taken out. And it really helps with the pain. Now, these drugs are completely legitimate and should be used. However, there was also a market created for their illicit use, which has led to an outbreak of heroin usage in this country and subsequent problems associated with that. And really to kind of highlight how intertwined the relationship is between these prescription painkillers and the heroin abuse in the country, I want to quote a recent report by the DEA, which came out in their 2015 National Drug Threat Assessment, which noted that for any decrease we've seen in controlled prescription painkiller usage, data indicates that there is a subsequent increase in heroin usage. So it's really like squeezing a balloon, kind of pushing the problem from one side to another. And that's why I feel that the solution we need to employ should not be based strictly on law enforcement standards, but should really emphasize the public health aspect of this and making sure that that public health is available to help save lives and communities. Starting in the 1990s, there was really an increase in the availability of prescription drugs, and it was seen as a very positive thing to help treat patients and help alleviate their pain. However, with that came a lot of users of these medications for legitimate purposes, and it also created an illegitimate market as well, just because there is such availability out there. And as authorities kind of realized that these medications were being abused, the pendulum started to swing back the other way, and there was a crackdown on their availability, leading to the noose kind of tightening, and people who had become addicted to these pills, either, again, because of their prescription or because of illegitimate use, had to turn to other options, specifically in the form of heroin, and that's what we have seen happen. Interestingly, OxyContin is one of the prescription painkillers I've mentioned. They really chose to use marketing materials such as branded fishing hats and stuffed children's toys to really get out the word about their product, which in retrospect probably wasn't necessary. And to underscore the extent of this problem and how much it's really reached the country at all different levels, if you look at the overdose rates, and this is information provided by Dr. Holly Hedegaard, who is a associate of the National Center for Health Statistics, as well as affiliated with the CDC, the Center for Disease Control. She notes that between 2000 and 2013, the overdose rate in this country related to heroin and opioid substances actually quadrupled. And it's not surprising when you look at this graphic, you can see the close relationship, again, trying to demonstrate the intertwined nature between prescription painkiller abuse and heroin addiction. And taking that information about that overdose rate, what makes it even more frightening, during this millennium, it's quadrupled. In New Jersey, it's actually 3 times higher than the national average. And most of the increase in these overdose rates actually occurred following the year 2010, which coincides with a rebranding, or I should say reformulation, of that medication, OxyContin, to make it less applicable for abuse, make it more tamper-resistant. And that's really when you start to see the overdoses occurring even more significantly. Now, fortunately, the solution to this, as I mentioned, is not just law enforcement. It needs to be addressed as a public health matter. by getting out the awareness of the issue and really trying to take this sort of out of the back alleys or kind of the closet and making it in the forefront so that people are comfortable to talk about, people suffering from addiction are more likely to get treatment. And that's been noted by many doctors, in particular Dr. John Roberts from the British National Health System has commented on the fact that having this conversation is really effective in terms of addicts who do enter treatment getting the care that they need and sticking with it and kind of following the treatment all the way through. Likewise, there needs to just be general awareness about the fact that these two really are intertwined. We saw before that prescription painkiller addicts are 40 times more likely to become addicted to heroin. And that would include people who are potentially taking these medicines for legitimate reasons. Anyone on an opioid-based medication for kind of a long term is at risk of becoming addicted to it. And really just making sure that that knowledge is out there is important. Furthermore, parents need to be aware that the medicine cabinet could be a place that their children look to get high or to get drugs. Fortunately, there are more options than ever for trying to treat this. And again, it can be in a outpatient setting. It doesn't need to be inpatient. It doesn't need to be intrusive on patients' lives. There are medications available such as Suboxone or naloxone, which can be used to help either treat drug addicts or actually reverse overdose in the case that that's occurring. So effective tools do exist for this fight, but the access to them is not always there. And I think really highlighting that is the fact that often you hear people say that the best way to get care is to get arrested because then you get put through the state system or it becomes court-ordered, whereas there's cost barriers to really receiving effective therapy and medication that might help treat addiction. Now, if I were to offer you guys a bag of heroin right now, would anyone take it? What about if it were after class? No, I'm kidding. But really, no one wakes up and intends on becoming an addict. It's something that happens through stages, through the breaking down of mental barriers. And again, the prescription painkillers is often that first step in kind of going down that road. So I say all this to keep emphasizing the need for treating this as a public health crisis, because without that mass attention and mass awareness, the situation is unlikely to improve. And if you think or look at statistics in neighborhoods where problems with heroin or opioid addiction has increased, crime goes up, you have higher rates of HIV transmission, and also higher rates of overdoses, of deaths of young people that could easily have been avoided. And that's a very interesting fact, because in 2009, for the first time, drug-related overdoses became the leading cause of injury-related death in this country, surpassing gun violence as well as motor vehicle accidents. And when you see the resources that are deployed to try and combat drunk driving or shootings and gang violence, I don't think the same level of effectiveness has been implemented to try and combat the opioid and heroin addiction crisis that we're seeing. But fortunately, there are steps that we can take to help, right? As I mentioned before, one of the most important is just simply being aware of the fact that these dangers are out there and making sure anyone that you know or anyone that will listen to you is aware of these dangers. Again, just the fact that the medicine cabinet could be the drugstore or the drug, it could be no different than buying drugs on the street corner. Likewise, knowledge about programs to really try and clean out where you might have excess medications. Maybe you did have a surgery and didn't finish all of your painkillers that were issued after. There's a program called the RX Drug Drop Box, and these boxes can be found really all across the country. You can put in your zip code. I actually used the one for Lawrence Township, so you can see Rider University is probably somewhere right around here. Plenty of options for parents or any really concerned individual who would want to remove their household of any medications which might pose a danger. And also, there are lots of options available to get help. There's 800 numbers which can be called really for that initial step, and then again, really making sure that people are aware of these resources and choosing to take advantage of them. And I would like to really conclude with kind of final remarks showing the extent of the problem and why we need to change the perception and treat it as a public health issue versus maintaining the status quo. This is a map of New Jersey, and kind of you can see where there were overdose-related deaths in the year 2004. 10 years later, this is what it looks like.
Yes.
What would it look like 10 years from now if we don't change anything? Thank you.